Suffering in silence. An estimated 47 million women in the U.S. are experiencing the effects of perimenopause or menopause, but it's considered to be one of the biggest blind spots in modern medicine. It can be a life or death situation for 51% of the population and has been mostly ignored until now. There are solutions, but it can be hard to find that help. KCRA3's Lisa Gonzalez gets the facts on silent dangers in women's health.
Hot flashes, weight gain, fatigue, mood swings. Most women in midlife will experience these symptoms during perimenopause or menopause.
The top 5 complaints are weight gain, weight gain, weight gain, weight gain.
Dr. Christina Sagosho is a former OBGYN who now specializes in helping women fix these issues and transition out of their reproductive years. Yes, there are fixes.
Symptom control is by gold standard taken care of with hormone replacement therapy. I always remind patients as we go through this transition, we are not going to get those hormones back. There are no supplements, there are no other mechanisms that are going to give us back what we're losing, and that is simply hormone replacement.
Dr. Sagosho herself suffered in silence through the symptoms and questioned her own medical training.
We've been gaslit for especially the last 20 years. I was telling myself, no, you're going to be fine. You're going to be fine. So for me, if I was gaslighting myself, how the hell was I going to take care of my patients properly? So when I figured it out and I realigned my thinking, and I started taking care of myself better and properly, it gave me more passion and more impact to say, no, we've got to do this better. And I will not be on the wrong side of history here.
Also working to be on the right side of history are several startups dedicated to helping middle-aged women. MIDI founder and CEO Joanna Strober isn't just trying to help women feel better, she's trying to help them live longer.
The same medications that you give women to fight perimenopause and menopause are those medications that actually keep our brains stronger, that keep our bones stronger, that keep our heart stronger.
Loss of estrogen can lead to potential fatal conditions later in life, especially when it comes to heart disease, the leading cause of death for women. Despite the need being so great, midlife women's health is considered to be one of the biggest blind spots in modern medicine.
I mean, I think a lot of women feel very dismissed by the medical system. They've been told, you're fine. That's what they've been told. You're not dying, you're fine. You know, they go in and they haven't been able to enjoy sex for a long period of time, or they're having anxiety attacks, they're feeling angry, they're feeling tired, and someone is telling them, you're fine.
Tech and lifestyle columnist Jennifer Jolly was one of those women who felt dismissed by her primary care doctor.
I had an older female physician tell me I was just running too much, and then I had a young female physician tell me that it's really just in my head. I couldn't exercise my menopause symptoms away. I couldn't vitamin them away. I couldn't meditate them away. I needed a doctor who would listen to me, and I needed someone in the medical profession who would work with me on it.
Things have really turned around in the last few years with $80 billion in femtech funding.
We are finally demanding data, we're demanding dignity, and design that really puts women's midlife needs front and center. We've never done that before. We're just coming into this power on our own.
But why now? Yes, it's big business, but it's bigger than that.
So it's an issue of equity. If you give women the appropriate care, they can thrive at work just the same way as men. But if you don't give them the care, they are suffering, and a lot of women end up leaving their jobs because of these issues.